We don't talk about maternal depression, but as many as 3 in 10 women suffer depression in pregnancy. As many as half of those depressed in pregnancy are depressed a year later. Maternal depression is often undiagnosed and therefore untreated. We investigated the extent to which treating maternal depression with cognitive behavioral therapy impacted their parenting behavior, playing with their children, which is important stimulation for cognitive development, or breastfeeding them, which is important for their long-run, all-round development. Depression causes fatigue, and a depressed woman might be less likely to make these critical investments. We interviewed about 1,000 women who were depressed in pregnancy in rural Pakistan. Some of them were given this cognitive behavioral therapy treatment, some were not. The treatment lasted till the child was 10 months old, and we tracked the mother-child pair and interviewed them again when the child was 7 years old. We then compare mother and child indicators for the two groups. We find that women who were treated with cognitive behavioral therapy are more likely to invest in time and money terms in their children. If you compare with women who were not depressed in pregnancy, 70 to 90% of that gap is closed by the therapy. We also find that women who were treated are more empowered 7 years later. We measure this as control over household income. Women who are depressed may find it harder to speak up for themselves, and it seems that the therapy supports them in overcoming that barrier. So we can't tell parents to be better parents, but by providing support for maternal depression, policymakers can empower women to be better parents. Our study shows a fairly low-cost, scalable, community-based cognitive behavioral therapy intervention can have transformative effects on the well-being of mothers and their parenting.